So many new moms, they have this doubt in their minds that is my baby developing normally, or is there anything which my baby is missing out? Is my baby achieving all the milestones at the proper age? Or is there anything which I can do to help my baby grow more healthier? So to all the dear moms out there, I just want to tell you that today we are going to discuss about the entire fascinating journey regarding the child's developmental milestones from birth till 2 years of age. So please watch this video till the end to get answers to all your questions. So let's get started. Namaste everyone, welcome to my channel 7 Sky Child Rehab. I'm Dr. Dhanvi, and today we are going to discuss about the child's fascinating journey about the developmental milestones. So in this video, I have covered only the gross motor milestones from birth till 2 years of age, because there are several milestones: gross motor, fine motor, social milestones, everything. But to avoid any confusions, we will first focus on the gross motor milestones. So what is gross motor? Gross motor involves the mass movements, the mass movement of the joints. For example, sitting or rolling over, those are the bigger movements. So right now, let's start from 0, that is from birth till 6 months of age. So from 0 to 3 months of age, the first milestone which the baby will achieve is the head control. Initially, when the baby is just born, from that day till the 3 months around, the baby doesn't have proper head control. So we are always asked to support the head of the baby. Now, by the end of 3 months, you will see that the baby's head will be fully supported, and the baby will be able to hold its own head upright. Now the question is that how to help babies achieve this head control in a better way. The first thing which you can give is give them tummy time, right? So tummy time is very important. You can start from the initial days only, starting from just few minutes, like from 3 to 5 minutes, and slowly increasing the time as the baby starts taking up. Because when you put the baby on the tummy, that is, the baby is facing downwards, what will happen is these muscles will get stronger and stronger. It will help the baby to lift the head properly. So every day when the baby is getting proper tummy time, these muscles are activated and they help in better head control, right? So this is a very important thing which all the parents should do from the initial few days till the baby gets a proper head control. But just keep in mind that you keep at least 1 hour gap after the feeding. So the tummy time you can give to the baby while baby is lying on the bed or on the floor if you are keeping a mat and keeping the baby on it. Or if you think that the baby is not comfortable in any ways, then mother can keep the baby on the lap and then give the tummy time. That will be very good because the baby will get the warmth of the mother, and then you can give. But please keep in mind that you keep at least 1 hour gap after feeding, then only give the tummy time. Like immediately after feeding, don't give this. Just take 1 hour gap and then go for tummy time. Now the next important milestone in 0 to 3 months of age is the baby will start finding the midline of the body. So what they will do is they will try to bring their hands towards their mouth. This is what they typically do, right? Because they are finding the center of their own body. So now how to encourage this more and more, like after the bath or after the oil massage or something, what you can do is you can encourage more and more of movements in the baby. Which kind of movements? I'll tell you. The movements will be, you have to take the right hand and push the right hand towards the left knee. Then you have to take the left hand, push it towards the right knee. Typically, a cross movement you have to encourage in the babies, because these cross movements will later form the connections in the brain which will help them in crawling milestone. So it is very important to encourage these movements right now. Second thing what you can do is the bicycle movements. We usually typically hold the legs and we do the bicycle movements, it's circular movements of the hips. That is also very important at this age. And this way you can do the movements is you can cross the legs and you can do the movements. Same way you can cross the hands, open it up, cross, open. These are the simple movements which you can encourage at this age. Now the third important milestone at this age the baby will achieve is tracking of the objects. So when you call the baby or you just move your hands and fingers, the baby will track. So whatever is going on near their eyes, they will follow that. It can be the sound of a rattle or something, but you keep it in a very soft and a little milder volume thing, because if there is too much loud sound, the baby can get that startle reaction and it will be creating unnecessary fear regarding that sound. So just keep very soothing and soft sounds. Even mother can sing song near the baby. That way you can encourage the tracking and visual perception in the babies. Now, from 4 months to 6 months of age, the important milestone which they will achieve is rolling. Now, what is rolling? First, the babies will start rolling from tummy to straight on the back. Later on, by the end of 6 months, they'll learn from back to tummy again. So this complete movement they will learn by the end of 6 months. Now, how to help them achieve this? Now, as the head control is achieved completely, so what you can do is, you can help the baby to roll over by making some sound on the other side, or by keeping some toy on the other side, so that the baby will try to go and grasp that. In order to take that, the baby will try rolling over and shifting to take that. Right. Now, initially the baby will struggle for rolling. So what you can do is, to help the baby achieve rolling faster, we have to hold the baby's one leg up and then go across the body so that baby can easily roll over. Right. This is very effective. Please try out. Now, the other important milestone which the baby will achieve between 4 to 6 months of age is pulling the whole body upwards using the hands. So they will use their hands down and they'll try to push the whole chest upwards, right? So this whole chest will go up using the hands. Now, to encourage this more and more so that the trunk control develops better, what you can do is, first keep the baby in this position, lying on the tummy. Then you show some toy or any such beautiful, colorful object which the baby likes to see, and then the baby will automatically go up for that toy this way. So this is very effective in developing the trunk control. So next important milestone which the baby will achieve by the end of 6 months is the supported sitting. So baby will start to learn sitting with support. So what you can do is, initially to encourage this, you can keep your hand behind so that the baby will feel safe and secure with proper support, and encourage this movement more and more. But keep in mind that the proper independent sitting will come by the end of 7 to 8 months. So just encourage the supported sitting right now till 6 months. Slowly, as the trunk control will develop, you will see the baby will move to independent sitting. So to summarize, I'll tell you is, what milestones baby will achieve from 0 to 3 months of the age will be the head control, the visual tracking, and finding the midline. And the exercises which I taught, you can give this to the baby from your side to encourage the baby for better progress. Now, from 3 to 6 months of the age, what milestone baby will achieve will be, first of all, the rolling. The second is pulling the chest upwards using the arms. Third is supported sitting. And you can follow the exercises which I taught for the better development of the baby. Thank you.